name is Jeremy Edwards with GAINSWave, and I'm here today with Dr. Judson Brandeis, GAINSWave provider in California. Dr. Brandeis, thank you for being with us today. And if you can start off by telling us what is your specialty and the type of your practice, please.
So I'm a urologist. I trained as a general urologist, but a couple of years ago, I actually transitioned to men's sexual medicine, and now I do men's sexual medicine and male rejuvenation.
Thank you so much. And you're located where exactly?
I'm in San Ramon, California. So that's the East Bay of Northern California. We're about 30 minutes from Oakland, 40 minutes from San Francisco.
Thank you very much. And on the subject of GAINSWave, Doctor, how did you first hear about GAINSWave and how long has it been part of your practice?
Sure. I first read about GAINSWave in an article in Urology Times that was about 2 years ago. And it really, really intrigued me. And initially, I didn't think it actually was going to work. But I was curious enough to fly down to Miami. I took the amazing GAINSWave training course and I brought it back to Northern California. And it's been a great part of my practice ever since then.
Thank you. And on the subject of GAINSWave membership, what features of the GAINSWave membership do you find most important, most valuable?
So in terms of the GAINSWave membership, certainly we get patients through the portal. So we get referrals of patients, which is a great way to start your GAINSWave practice, but also the journal clubs that myself and others have put together are really a valuable source of new information so that as a group, the GAINSWave community continues to learn and to grow and to progress.
Thank you so much. And I'd like to thank you personally for your involvement and your creation of the Journal Club. A lot of our GAINSWave providers really appreciate those Journal Club sessions. On the subject of patients, how have your GAINSWave patients responded to treatment? Good outcomes, I hope?
Yeah, you know, the thing is, if your only tool is a hammer, then everything looks like a nail. So GAINSWave is just one tool in a toolbox that we all should have, including nitric oxide boosters, including PDE5 inhibitors, including GAINSWave, including vacuum erection devices, PRP injections, PT141, oxytocin. You know, it is definitely a very valuable tool, and it's really the only tool out there to promote neovascularization of the growth of new blood vessels. And it's really important that we all use it in the capacity that it's best suited for. So not every single patient that walks into your office is going to be a good candidate. And so in order to have happy patients and in order to have good results, it's important to properly select patients. And properly selected patients, it works fantastically well and patients are really happy. But to have a successful GAINSWave practice, it's really important to select your patients properly. I mean, if you have someone who's had a prostatectomy that had their nerves cut, don't do GAINSWave. You're going to get those patients upset. You're going to get a bad reputation. Or if you have a brittle type 1, type 2 diabetic that doesn't even respond to Trimix, don't even bother trying on those patients, because those patients are going to tell their friends that it doesn't work, or they tell their doctors that it doesn't work. But you know, for a 55 or 65-year-old patient who has mild to moderate erectile dysfunction, it's life-changing for them. And they're the ones that are going to tell their friends and their colleagues and their family that you really help them.
What would you tell a fellow doctor who's considering adding GAINSWave to his or her practice?
I think in this day and age, it's essential. You know, insurance is going to continue to pay less and less. Patients aren't coming into the office like they used to. And adding something like GAINSWave that's a cash-based part of your practice that men really respond to, that'll bring men into your practice, is a fantastic idea. You know, you shouldn't rely on the insurance-based medical system because it's going to crumble. I mean, it's inevitable.
Dr. Judson Brandeis, thank you very much.